All right. So today I'm presenting an analysis comparing past year and past week measures of food insecurity, in which we found that measuring food insecurity in the past year leads to underreporting, especially among individuals whose experiences of food insecurity were less frequent and less recent. We're motivated to do this work because food insecurity is unjust in a country with plenty of food. Additionally, from a public health perspective, food insecurity causes poor nutrition, diet-related disease, and poor mental health, and is a driver of health disparities. To keep track of food insecurity, most public health surveillance, like the annual USDA survey, asks people about their experiences of food insecurity over the past year. They ask about experiences like skipping meals or going without eating for a whole day because of a lack of money. So the results of the research that I'll share today indicate that these annual measures may result in underreporting of food insecurity. From 2019 to 2021, annual estimates from the USDA showed that national rates of food insecurity remained unchanged at about 10%, and they reported similar rates for the state of California for that time period. But local surveys, including surveys conducted in Los Angeles County, detected spikes in food insecurity throughout the first year of the COVID-19 pandemic. These surveys typically ask people to reflect on their experiences during the past week or the past month. So it was also obvious on the ground that people needed food based on visibly long lines at food pantries and reports from our community partners in Los Angeles. Based on all of this information, we suspect that the national food insecurity rates were underestimated, which is a serious issue because these USDA rates are a major driver of funding and public health resources for food insecurity. To provide some background about memory and survey research, survey questions covering longer timeframes, such as asking individuals to recall the past year compared to the past week, typically lead to underreporting. Memory research shows that underreporting in response to survey questions may happen for several reasons. First, if a person has experienced something less frequently, such as annual visits to a healthcare provider, that person is more likely to underreport their healthcare usage compared to someone who visits their healthcare provider every month. Second, the severity of an event may influence underreporting. For example, drivers who watched film clips of traffic situations and were asked 2 weeks later about what they saw were more likely to underreport mild near accidents compared to severe near accidents. And third, how recently an individual has had an experience may influence underreporting. Generally, people are less likely to remember events such as sick leave usage or alcohol use if they happened less recently, and are thus more likely to underreport these events when they're asked to recall a longer time frame. So we're using unique data from a panel survey of participants to the UAS who were surveyed frequently about past week food insecurity and also surveyed about their food insecurity over the past year. We asked two research questions. First, was past year food insecurity underreported by participants compared to their reports of past week food insecurity? And second, were participants more likely to underreport past year food insecurity when their past week food insecurity was less frequent, severe, and recent? All right, so we use data from the UAS, a nationally representative panel with an oversample of Los Angeles County adults who are demographically representative of the population of LA. We focused on the approximately 1,100 LA County adults who participated in the UAS from December 2020 through January 2022. So the LA sample of the UAS completed two different measures of food insecurity. First, participants reported their past year food insecurity in December 2021 using 5 questions from the US Household Food Security Survey Module short form. This is the same measure used by the USDA for their annual rates of food insecurity. And second, participants reported their past week food insecurity at 11 different times throughout 2021 using 2 questions from the Food Insecurity Experiences Scale, or the FIS. These 2 questions assess behavioral markers of moderate and severe food insecurity, and the 11 surveys that included the measure of past week food insecurity are shown in the little graphic up here. Both of these measures of food insecurity assess similar types of events, such as eating less food and skipping meals. And we know participants also reported about their demographics, which we used as controls in regression models. Okay. So using the past year and past week measures of food insecurity, we constructed several indicators to represent participants' experiences of food insecurity. Based on the established scoring guidelines of the USDA food insecurity module, we categorized participants as either past year food insecure or past year food secure. And then we conceptualized past week food insecurity in 4 different ways. First, we considered participants' responses to the FIES questions about past week food insecurity on these 11 different surveys in 2021. If a participant reported any past week food insecurity at any of these 11 times, they were coded as having any past week food insecurity in 2021. And participants who reported no food security on all 11 surveys were coded as having no past week food insecurity. Second, to represent frequency of past week food insecurity, we grouped participants into 5 categories based on their past week food insecurity at each survey wave. Third, to represent severity of past week food insecurity, we considered participants' responses to the severe FIES question, which is, in the past 7 days, did you go without eating for a whole day because of a lack of money or other resources? A participant was coded as experiencing severe past week food insecurity if they responded yes to this question at least once during the year. And finally, to represent recency of past week food insecurity, we considered participants' responses to the 2 FIES questions in the December 2021 wave of the UAS. So participants who responded yes to one of these questions were considered to have experienced recent past week food insecurity. So some results, weighted descriptive statistics showed a past week food insecurity rate of 19.6% among this socioeconomically and demographically diverse population of LA County in 2021. And in our UAS sample, this corresponded to 206 participants who reported any past week food insecurity. So this subsample of 206 participants is the focus of our analysis. Regarding our first research question, whether past year food insecurity was underreported by participants compared to their reports of past week food insecurity, we found that 1/3 of participants who reported any past week food insecurity did not report past year food insecurity in December 2021. So in other words, in red here, 33% of participants underreported their past year food insecurity. Moving on to the second research question, the color codes are the same here, regarding whether participants were more likely to underreport past year food insecurity when their past week food insecurity was less frequent, severe, and recent. And again, focusing on these 206 participants who reported any past week food insecurity. We examined the past week food insecurity constructs of participants who reported that they were past year food secure, or these are the underreporters reporting past week food insecurity and past year food security, shown here in red. And we're comparing to those who reported past year food insecurity, or the consistent reporters, who are shown here in green. So first, considering frequency of past week food insecurity, we can see a larger proportion of underreporters had reported past week food insecurity at only 1 survey wave, and a very small proportion of underreporters reported past week food insecurity at 6 or more waves, compared to those who consistently reported both past week and past year food insecurity. Considering severity of past week food insecurity, we see a slightly smaller proportion of underreporters reported any severe past week food insecurity compared to those who consistently reported. And considering recency of past week food insecurity, a smaller proportion, much smaller proportion of underreporters reported past week food insecurity in December 2021 compared to those who consistently reported. And that is the same survey where they were asked about both past week and past year food insecurity. Continuing with our second research question, and again, focusing on that 206 participants who reported any past week food insecurity, we used logistic regression to further explore the relationships between frequency, severity, and recency of past week food insecurity and our binary outcome of underreporting of past year food insecurity. So the results of this logistic regression analysis show that the odds of underreporting past year food insecurity were significantly higher among participants who only reported past week food insecurity at one wave compared to those who reported past week food insecurity at 6 or more waves. And the odds of underreporting were significantly higher among participants who did not report past week food insecurity in December compared to those who did. So that's sort of a recency effect. We also found that the odds of underreporting were significantly higher among individuals with incomes between 100–200% of the federal poverty line, and also those with incomes above 300% of the federal poverty line. So that is relatively higher income individuals compared to those with participants with incomes below the poverty line. We can see here that severity of past week food insecurity and other demographic covariates did not significantly predict underreporting. So to summarize our key findings and conclusions, about 1 in 3 participants who reported past week food insecurity in 2021 underreported past year food insecurity in December of 2021. Underreporting was more likely if people had less frequent and less recent reports of past week food insecurity, which is evidence that underreporting is related to recall bias. Additionally, some higher income individuals in our sample reported experiences of past week food insecurity, and these individuals were more likely to underreport past year food insecurity, suggesting that underreporting may also be related to stigma and social desirability bias. Lastly, these findings have several public health implications. First, our major surveillance is likely underestimating food insecurity. These findings show substantial underreporting of past year food insecurity, but most public health surveillance uses past year measures that are often assessed at just one time point during the year, typically in December. These types of measures may be missing fluctuations in food insecurity that occur throughout the year, which is likely what happened in April and May of 2020 when the pandemic was just starting and food insecurity was very high. There's a large literature demonstrating that food insecurity is related to increased risk of chronic diseases such as diabetes and hypertension, as well as increased risk of poor mental health outcomes. However, if people with less recent or less frequent food insecurity are underreporting on past year measures, the impact of food insecurity on overall population health may be underestimated as well. Okay. Additionally, underreporting may have important implications for food equity and disparities. Specifically, race and ethnicity typically do not predict food insecurity, or in this study, food insecurity underreporting. Yet food insecurity is more common among some communities of color, which have greater exposures to the barriers that put families at risk of food insecurity. So accurate measurement of food insecurity is critical for both documenting and addressing inequities in food access and in health. Okay, and I'm so grateful to be here on behalf of my team from USC, including Wendy, Kayla, John Wilson, Bruce at CUNY, and then a couple collaborators from the LA County Chief Sustainability Office, as well as our project management team. And we're very happy to be funded by USC and the NSF as well. And please feel free to reach out if you have any questions, and I'm happy to answer them here.